Hi guys, welcome to this channel. If you've never met this bold, beautiful, wonderful lady, my name is Lorna Kerubo. I'm a public health officer by profession. I have done another video before, so make sure that you check out those videos. Make sure that you subscribe to this channel, because if you do, you're going to enable us to create more content like this. Make sure that you like and also interact with us in the comment section. So today we're going to discuss about sexually transmitted diseases, and to be precise, we are going to discuss about bacterial sexually transmitted diseases. So we have different types of sexually transmitted infections. Those that are caused by bacteria, and the other ones that are caused by a virus or viruses. And the difference is that the ones that are caused by bacteria can be cured. You can be given antibiotics and then you don't have the bacteria anymore. But when it comes to the one that are caused by the virus, that means that the virus, you cannot be cured. You can only be given medication to manage it, but once the virus is in your body, you cannot be able to heal from it. Examples of bacterial STIs, we have gonorrhea, syphilis, and chlamydia. And we're going to start with chlamydia. Chlamydia is caused by a bacteria known as Chlamydia trachomatic, and you get it when you have unprotected sex with someone who is infected. That is vaginal, anal, or genital sex. And female are more susceptible to getting the disease because, of course, we have open reproductive system, and also young ladies, that is 15 to 24, are more susceptible because their mucous membrane, their vaginal mucous membrane, has not yet fully developed. So that means that they are quite more likely to get the disease. That doesn't mean that other people from other ages cannot get it, but they are more susceptible to getting it. So on the signs and symptoms of chlamydia, most people don't show signs and symptoms for this disease, to be precise, but for the ladies, sana or mostly, there are no signs and symptoms. For the men, 70% don't show, but maybe around 30% show the signs and symptoms, which are discharge from the urethra, that is, can be greenish, yellowish, or some abnormal discharge, pain when urinating, and also discomfort on your genital areas. And for the ladies, we've said, of course, most don't show, but you might get a little bit of discharge or discomfort around the area. You might feel a little bit itchy. So it is encouraged that you get screening and checking to know that if you have, to know that you don't have the disease or any sexually transmitted diseases. If you get symptoms, you should be treated, but if you don't go for treatment early or don't take antibiotics early, definitely going to progress to more complications in your body. So for the ladies, you might get, your pelvic area might be inflamed, you might be infertile, or ectopic pregnancies in case you get pregnant and you don't know you have the disease. For the male, your prostate glands may be infected, maybe later causing other serious infections like cancers or other diseases. So make sure that you get tested. So for the treatment, of course, you must go to the doctor for him to prescribe the exact antibiotics. For example, doxycycline is one of the antibiotics that are used to treat this specific disease. The second STI is gonorrhea. We're going to talk about gonorrhea. And gonorrhea is caused by a bacteria, that is Neisseria gonorrhoeae. And it is both ages, all men and women are susceptible to getting the disease. If you have sex with someone who's infected with the disease, unprotected sex, you're definitely going to get the disease. Also, from mother to child during childbirth, it can be transmitted from mother to child during childbirth. So it is the second most reported STI after chlamydia. Chlamydia occurs more, and then gonorrhea follows. So on the signs and symptoms of gonorrhea, we have said that most of this don't show in most people, majorly men and women. But in case they show, this is how they present themselves. In men, the discharge is going to be abnormal. Definitely, if you see any discharge that's abnormal, that is, you should be alerted. Then you have itchiness, you feel itchy or discomfort in your genital areas. Also, if you feel pain while you're urinating, that is, of course, a sign. For the ladies, you have your swollen, your labia and the genital area may be swollen. Also, you have discharges that are not, of course, familiar, or maybe more discharge than normal, and you feel a bit discomfort. That is why you are expected to know your body, so that you may know if you have any changes down there. You definitely should be alerted. Also, for in case you don't get treated, that is, in case you don't get treated early, these symptoms go away after some time. They present themselves 2 to 5 weeks, and then after that they might go away. And if you stay with it for long, it may cause other complications like infertility for men and women, both men and women. It may cause inflammation in your pelvic area. It may cause ectopic pregnancies for the female. It may also cause your prostate glands may be swollen, or maybe infections in your, you may get epididymis, that is some infection in your areas. For the treatment, of course, you have to see a doctor so that he can prescribe the correct antibiotics. But in case you need to go over the counter, you can get cefixime as an antibiotic for this. So we go to the next one, which is syphilis. Syphilis, of course, is caused by a bacteria known as Treponema pallidum, and it is, of course, caused by, if you have sexual intercourse with someone who's infected, unprotected, underline the word unprotected, sexual intercourse with someone who's infected, you're definitely going to have it. It can be passed from mother to child also during childbirth. You've noticed that most of this bacterial can transmit from mother to child during childbirth. Also, if you cannot be transferred if you shared clothing or maybe utensils or through sweats, no. But if you have sex, definitely you're going to get the disease. Both men and women, all ages can get it. So the infection could appear either the lips, or the genital area, or the anus. So we have different stages of syphilis. We're going to start with the primary stage, and this primary stage is it starts with maybe a sore, or in any area. It could be the anus or the genital area. The genital area, when I'm talking about the genital area, I mean the penile for the men and the vagina or the vaginal area for the women. So it can occur like a sore, which is the anal one is not painful, is not painful at all. So you will rarely notice it, but for the one that is going to be in the genital area is really painful. Definitely you're going to notice it. It can come 1 or maybe 2, or maybe a little bit more than 2, but you definitely will notice it if it is in the genital area. But after some time, it will definitely go away if you don't take treatment and proceed to the next stage, which is the secondary stage. On the secondary stage, it occurs for around 4 weeks after the primary stage has faded off, and this is characterized by, you have rashes on your body, brown rashes on your body. They can extend even to your the palms of your hand or the palms of your legs. Then you have sore throats. You have sores in your mouth, on your throat, even in your genitals. And it can be, you can have, for the male, of course, it's going to be characterized by having discharges, having discomfort in your genital areas. For the ladies, of course, it's going to be called, you're also going to have some discomfort, of course, and some discharge that is not normal, or over discharge that is more than normal. So in the secondary stage, someone is really highly infectious, so because you have sores all over your mouth and also your genital area. So we go to the latent stage. This stage is merely still, you don't have any serious symptoms, you're just normal, and then it proceeds, if you don't get treated, proceeds to the final stage, the tertiary stage. And on this stage, of course, it has already damaged. Someone can live with it from 10 years to around 30 years. And there are no physical symptoms, but of course, the internal organs have already been damaged. We're talking about the blood vessels, we're talking about the heart, you may have the head, the brain, you have strokes, you may have dementia, you may have hearing problems, you may have infertility, or maybe cancers. We may have other symptoms like fever or sore throat, maybe swollen lymph nodes. That means you have infections. Don't be alerted. These are other symptoms that come with it. For treatment, of course, you get antibiotics. Penicillin could work, but make sure you visit a doctor to be able to prescribe the right antibiotic that you might need for this. And now that we have talked about the bacterial infections, let's talk about how to prevent yourself. One, make sure that you use condoms or dental dams when you're having sex. Or if you have a partner, you make sure that you have checked yourself to see that you don't have any diseases. For those who pregnant mothers, make sure that you are checked before you're screened before giving birth. And of course, for the management, health education is important. Those who know about it, make sure that you give information to the others who don't know about it. Also, make sure that you go for screening. For ladies, we've said that, and men, that it is not, you don't normally know when you have it. Make sure that you schedule screening with your gynae at least per year. If you have reached this far, thank you so much for watching. If you haven't subscribed, please make sure that you subscribe to this channel. Also engage with us in the comment section. Ask us any questions. Tell us if there's any topic that you feel like you want us to handle. Until the next video, see you.